Before entering the room, I went ahead and checked the patient's chart. I went ahead and gathered my supplies and made sure I had everything I need. We're going to do some nasal suctioning, so I went ahead and grabbed a couple different nasal trumpets to make sure I have the right size for the patient. I have a couple sets of the suction catheter tray. It's sterile, and then a couple of sterile saline syringes. So the first thing I'm going to do is go ahead and knock on the patient's door, ask permission to come in, talk to the patient, and introduce myself. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory department. It sounds like you're having some trouble breathing here and getting up some of that phlegm and mucus inside your airways. So today the doctor is ordered to do some nasal suctioning. And with that, we just have to hook up. Oh, I also brought in a suction canister if it wasn't already set up in the room. And so I would make sure I have everything set up on the wall for that first. I would go ahead and ask permission to check the patient's vitals. So get respiration rate. Mrs. Smith, can you go ahead and take some deep breaths for me? Listen to her lungs. Can you give me a cough? Okay. And because it's a sterile procedure, I would have already washed my hands before I did the assessment, but I'm going to first have and put the gloves on while I did my assessment to her. First, Ms. Smith, I want to see what size nasal trumpet we have. So you can see here from the nose to the ear, this is quite long. It goes past your ear. So we're going to try this one. This one will go right here, and it goes right to her earlobe. So this one looks like the best fit for Mrs. Smith. So we'll go ahead and grab my suction catheter sterile tray, and I'm going to go ahead and open it up, and you'll see two sets of gloves in there first. My left hand is going to be my clean hand. My right hand is going to be my sterile hand. I had set up the suction catheter, or the suction to the wall, and it's set at -20. For a patient, an adult patient, you want to set it in the range between -120 and -150. So with my clean hand, I'm going to go ahead and hyperoxygenate Mrs. Smith. Just take some normal breaths for me, Mrs. Smith. We'll give you some oxygen. We're going to go ahead and insert a little nasal trumpet into your right nostril here, and then that'll help ease suctioning some of that stuff up, okay? So now that she's hyperoxygenated, I will go ahead and with my clean hand, put some lube on my hand, on my sterile hand, get the nasal trumpet. And you always want the bevel facing towards the septum. And with a smooth motion, I'm going to go ahead and ask my patient to take a deep breath in. 1, 2, 3, and insert. Trying to make it as smooth as possible. Put that in there. So now my sterile hand, I'm also going to go ahead and grab the catheter. I'm going to, with my clean hand, hook it up to the wall and go ahead and run my hand through the tip of it so it's nice and lubed up. Now, Mrs. Smith, we're going to go ahead and suction you out. Take a deep breath in for me. And when we do this, we want it to take no longer than 15 seconds. So I'm going to insert quickly, feel a little resistance, pull back, and occlude the thumb hole. Go ahead and pull out. Try not to kink my tubing while I'm doing it so we get some good suction coming out. I'll go ahead and put my catheter down, hyperoxygenate Miss Smith again. Take some deep breaths for me. A lot of times the patient's going to gag, cough, and be pretty uncomfortable throughout it. So I'll monitor her oxygen levels and see if she can handle another suction. And if not, then we'll go ahead and try again later if she needs it. I'll listen to her heart rate. Put her bed in a low locked position, make sure she has everything she needs. Mrs. Smith, we're going to go ahead and leave the nasal trumpet in your nose right now, just so we don't have to take it in and out, and I'll come back in a little bit and we'll go ahead and suction it out again, okay? Okay, so